Hi. Good morning for anyone that's just joining us. We're about to get started. Welcome, everyone. I know it's very early on your end. Okay, so let's start off by getting some of these housekeeping items. So welcome everyone to today's webinar that is hosted by DBHR through Washington State Healthcare Authority. This is an interactive training, and we encourage you to ask questions and participate throughout this session. So please note that the use of automated note-taking bots or similar tools during the WAFCS events or meetings requires prior approval. Unauthorized use of such tools is prohibited, and to ensure the privacy and confidentiality of all attendees. Also, any recording that is created through AI is not recognized as an official recording of this session. We reserve the right to exit trainees from the training if they are using AI to take notes without prior approval or using AI to record this session. Okay. And please know the materials are recorded and will no longer be emailed to participants. So materials will be uploaded.
Yeah, when you're in probably the number. Okay. Cinematic mode with the tripod. Oh my god.
So materials will be put in the chat during the end of today's session. And also you could access the YouTube in about 2 weeks on the HCAFCS channel YouTube channel within 2 weeks. Okay, so now that we've gotten that out of the way, today we are the skill teaching that we're going to focus on is asking for help. My name is Mandea Nuhu Suleimana, and I'm with the Integrated Employment Institute with Rutgers within the Department of Psychiatric Rehabilitation Psychiatric Rehabilitation and Counseling Professions at Rutgers University. And I just wanted to welcome everybody and thank you so much for joining us for today's training. And I look forward to the 90 minutes we're going to be spending together on this topic. Okay, it's going to be interactive. So, I just first want to acknowledge Dr. Janice Osler for developing the skills teaching curriculum on, the various soft skills, presenting qualification, asking for help, conversing with others, and responding to feedback. Dr. Osler is the director of our psychiatric rehabilitation and clinic. Thank you, everyone, for your patience. I had a Zoom issue. I hope it works now. I apologize for the technical difficulty. And thank you so much for your patience. I really appreciate it. Okay, let's get back to it. I apologize. Okay, let's see. If we could mute. All right. Thank you so much, everyone, once again, and thanks for your patience. So we're going to do a fun activity to start with, and I hope everybody can hear me. So for a warm-up activity, if we could please think of a skill that is unteachable, quote unquote unteachable, that someone may ask you, maybe one of your clients may ask you to teach or help with. So for example, a skill such as, feeling confident or how to stop worrying or how to be motivated. And then I want everybody to kind of think of one skill that you think may be unteachable. Put it, come up with the 4 steps on how you may teach someone that's to develop that skill that may be unteachable. And you could type it in the chat or unmute. But for now, if you type it in the chat, don't send yet. Don't hit the send button. I'm going to alert everybody on when to click send. Okay. So let's take like 1 minute or so to do this. Okay. Thank you so much, Teresa, for letting me know. So now, if everybody has kind of come up with a skill that they think is unteachable and the 4 steps and how they may teach someone and how to acquire that specific skill, please send it into the chat right now or unmute and share. Okay, so you can all put in the chat and let's see. Or feel free, if it's easier to unmute and share what skill that you came up with and what may be unteachable. A skill that's unteachable, but you came up with 4 observable steps on how to teach it. Please put in the chat, please unmute. We're just only a few of us. So let's unmute. Let's make this as interactive as possible. It's just us. All right. So if anybody picks maybe one of the examples I put on there, confident, how would you teach someone to feel confident? Okay, let's see. I have, okay, Shay said solving the Rubik Cube. Yes. First, teach them how to identify the pieces. Second, how to move the cubes. Third, how to arrange them. And fourth, solve each layer. Excellent. Okay, Victoria, thanks for letting us know. Who else? Who else want to put something that may be unteachable? I like that, Shay. It's very, short, direct steps you provided us. Anyone else? One more. What is something that maybe a client presented to you as something they wanted to learn this week or a few months back? Let's see. How to listen. Very good, Holly. So first, we want to turn the body towards the person. Then we want to look in their eyes, right? Then, or face, put down the phone or other items, nod or repeat back what you heard. Excellent. These are all good examples. So this was, a nice warm-up activity. So let's start off with what are skills, right? So we hear that so a skill are when we talk about skills, the definition of it being sets of practice behaviors that enable a person to achieve his or her goal. So it's like a technical definition of what skills are. But when we are trying to understand what a skill really is first a skill is behavioral and observable, right? So we should be able to see that action that the other person is doing, or we should be able to also hear it. For example, maintaining eye contact during an interview would be a behavior and observable skill. You could see, how do we observe someone is actually making eye contact. They're looking directly either in our eyes, right? But we also have to think of some of our clients in a cultural context, because some cultures looking directly into someone's eyes when you're speaking can be considered rude or disrespectful, right? So again, it may differ for different clients, but we know here, where we live in the United States, eye contact is important. If not, we assume that the person is either ignoring us or does not is not paying attention to what we are saying, right? So a skill also should be purposeful. So meaning it's important, it's performed intentionally or with specific goals in mind. So for example, using a tone of voice to convey a calm confidence when negotiating salary, right? So when we're teaching our individuals who are maybe want to talk about a raise, there's a way of doing it, not saying, demanding voice, right? They're not, of course, nobody's going to listen to that or even give us that raise. So a skill is also generalizable. So what that means is that you can use it in many different situations. So it's not just that one situation and you don't have to do it again. So for presenting our qualification, we mostly think of it at a job interview or at a school interview, but sometimes you have to sell yourself out of, in a way it doesn't have to only apply to work. So when we are thinking of our individuals, when we are teaching them the skills, they should may be able to apply it on the job, on the home, or at the grocery store, or somewhere in a public setting that is not work or school related, right? So for example, the ability to articulate or concise request for a deadline extension. How are they going to do that? Or asking for help, right? A skill is compound. So it requires combining the knowledge that you know with the action to go with the action. So, for example, giving effective or receiving feedback from your supervisor. So, either conversing with people, receiving feedback, those are knowing how to do it and applying the skill with it, along with it. So a skill is standardized. So this, if you're asking for help or if you're presenting a qualification, there's a recognized way of doing it. So for example, that would be shaking hands. So when we're showing our individuals how to shake hands, we're showing them that firm handshake. And if they're doing that fist bump, that, direct with a direct eye contact, if they're either doing a fist bump or a handshake. So a skill is stable, so it's consistent and observable over time and in various situations as well. So with the direct skills teaching, they focus more on a skill being observable. So they're able to measure this. They be like we just talked about, you can see it, right? The laser focus is that you have a plan, there's a goal to what you want to achieve. And at the beginning of our session, we did the warm-up activity where I asked you to come up with a skill that is almost impossible to teach and break it down into 4 manageable steps. So they focus on more on breaking down the skills into that 4 main steps, right? So if it's teaching someone how to request an accommodation, or teaching someone how to present their qualification, right? And also a skill, the direct skill teaching part of it focuses on knowledge base, which means the teaching includes necessary background information, which is the body of knowledge to support that specific skill. So, for example, understanding the difference between a passive behavior, avoiding the issue, and an aggressive behavior, attacking a person. And the high impact of the skill would be crucial to ensure that the person, for example, if the skill directly leads to the client receiving a fair pay, so they're able to do this. So if someone presents their qualification, at the end of the day, the goal is for them to get that job that they're applying to, right? So we have in the Boston University skills teaching model, there are 5 elements to teaching a skill. The first element is naming what that skill is, right? So if the skill is active listening or making a request, that's the name of the skill. So the definition is going to be describing what the skill will look like. So a brief, clear statement explaining what the skill is, what the client's intention is, and to ensure everyone has a common understanding. So the benefits of the skill is if the person does A, B, right? The benefits should be the outcome that they're looking to achieve, which is whether it's applying for a job, whether it's receiving a job accommodation, whether it's getting accepted to a school, right? That skill should result the outcome, the desirable outcome the individual is looking for. So the list of key behaviors is what in this place is their steps, but in Boston University, teaching model. They're called behaviors. So, which some of you listed examples of and provided for specific things to do. And finally, the condition, meaning where can the person perform this skill? Is it at a grocery store, at home, at work, where? In a social setting, that would be a specific condition. So now we are going to do this is all of us. We're doing it here together. We're going to practice what we just learned about the 5 elements and try to apply here in supporting a client. You're teaching a client how to file folders in an office filing cabinet. So that I've already given you the name of the skill. Who would feel free to please put in the chat or unmute and provide the definition of the skill. How would we define filing folders in an office filing cabinet? What would be the definition to this skill? Anyone? Okay. Labeling and organizing to make it easy to find. Excellent. So that's an example. The benefits of learning the skill. If you want, you could please put in the chat or unmute. So the benefit would be what? Staying organized, right? And keeping having. So what do they say? Organization is simply everything has its place. So the list of key behaviors, how would you list 4 ways a person can file folders? So first block, they may have to put it in alpha order, right? And if it's color coded, then if it's color coded by alpha order, then they would place it accordingly, right? So they will come up with 4 specific behaviors or steps in this case on how to teach your client in applying the skill. And finally, when to use the skill. How they're going to use the skill? Are they using it just when they're in the office? Maybe they could use it at home or when they work somewhere else. They're going to always be able to apply this skill. So today, our focus is asking for help is our skill. So before we go dive into asking for help, I just have a few questions here that we could all take a moment and think about it. And you can feel free. I encourage everybody to mute and share. It's fine with me. Or you can put it in the chat, whatever is comfortable to you. So the first question is, what have you observed about your clients around the skill asking for help? Do you find your clients being more comfortable asking for help, or do you find them more feeling, resistant or afraid to do so? I mean, hesitant. Feel free to unmute. It's okay. It's good. I would love to hear some voices. Some are anxious to ask, some seem unsure how to even approach asking. Yes. And why do you think that happens? What are some of the reasons, if they've given you any, about why they're either afraid or okay. I see Holly said most people I work with struggle and often ask for help after issues happen. Right. So that's what we mostly see with our individuals, that they ask for the help after, you know, they had bad experience. Yes. And not so let's think of our own selves in the past, like or whether now or if you've ever had a bad experience asking for help, it makes it hard, right? To ask because you're like, I had a bad experience asking. How will I even if I should ask for help? So imagine our individuals. So sometimes if there are multiple issues going on, it's hard to know where to start with asking for help. Absolutely. Lily, you are more than welcome to unmute and elaborate on that point you just shared with us.
I think that's
So
about it. I think I've just noticed clients, um, yeah, feeling overwhelmed with the process of getting a job. And if you don't know many skills to begin with, it's hard to know what questions to ask.
Absolutely. Thank you. Anyone else want to elaborate? So now, if not, I want us to also think about what are some barriers and challenges that our consumers experience around asking for help. So I want to think us to think of it in the context. Is it that they have trouble asking for help because people always just jump in to do everything for them. They don't like family members don't even allow them to use their voice to ask for help. And it's like everybody sees disability first. So everybody is just like, oh, automatically I have to cultural differences. Okay. Tatiana, you want to elaborate on the cultural differences point you brought up? I think that's an excellent point.
Yes, I can do that. Yes, I had situation when the family was from different country, and it took me time to establish connection with them until almost when they was close to this school, and they actually just open up that they need help with something. And I think that very important establishing the connection, different ways. It depends on the, of course, work environment, the situation. That would be really helpful to gain the trust because, when somebody from different culture, maybe the elderly people, they think they're supposed to help somebody, right? They're not to get to ask about help, and it's for them it's being asked, it's something like below them or some kind of dignity, especially when it's male, and so that's what I saw in my experience, that it's about dignity and it's about trust, and it's about establishing connection with the customers.
Okay, excellent. Thank you for that, Tatiana. So you're right. Cultural differences that play a role whether the person is going to be able to comfortably ask for help or feel like it's making them um less than what they're supposed to be doing, especially in their role, like Tatiana used elderly versus a younger person. um so I see Teresa also put an excellent point about communication barriers, access barriers for individuals who are deaf. That's excellent because it's true. With that, maybe that's why people may not ask for help because they feel like the people other people may not be able to relate or help them with what they need. And I see Alana said sometimes it's hard for her to ask for help because of bad experience, which we've all had, right? I've had it in the past where someone has said to me, "Oh, are you sure you have a college degree because you need help?" I had a question about needing help for something, right? So it's some people will shame you for asking for help and some people would not. So just think of our individuals who have a disability, who are being kind of viewed as disability first by other people. They may not want to, right? Because they don't want it to seem that they're not able to do what, either the task or be stigmatized even further. So I see F says, personally, when I was very curious, a curious child, the dad did his best to try to stop my asking. My mother embraced me, so I have had to dig over the years to use my voice. Yes, that would, yep. Either bad experience from childhood or previous work. Thank you so much, F West, for sharing that. That happens to a lot of us, right? So, what has been your experiences, good and bad? And it sounds like some of you have already answered this question around asking for your individuals asking for help, whether at a job or at work. Has anybody had a client who has asked for help and it's not been a good experience or it's actually benefited them in a good way? So I feel I could share an example. When I worked as a job coach, I had an individual where I well, this was not more asking for help. This was more helping the individual advocate for a promotion because they've been working there for 10 years and they never got considered to move them to the next position, right? So by doing so, the individual was now considered to get a promotion, which would mean a better pay. So, what are some of the benefits of equipping our consumers with the skill asking for help? What would that do for our individuals? I so Terry says, I write in cursive handwriting. Younger generation cannot read as they are not taught how to write cursively. Some cannot read due to learning disability. I adapt to find some ways that works. Not 100% though. That's true. Thank you for that, Teresa. So generation gap, right? Not a lot of people are being taught, and I agree about cursive handwriting as they did before. So this is the skill asking for help we're focusing on. And the definition of it is asking for help means making a request to others to assist you. So the benefit of the skill when we are supporting our individuals is to make other people aware of their needs for assistance. So the 4 steps we're going to focus on, which you're calling it behaviors, is evaluating of the situation, identifying method to get assistance, selecting a person to ask, and presenting your request. So this skill can be used either on the job or in social situations. So the first one I want us to evaluating, what does evaluating a situation mean? And so evaluating a situation means that we think about what we that we think about and consider what is going on. So if our individuals are presented with a difficult situation, whether at work or at school, they're able to assess the situation and identify maybe what type of help may would they need, right? So you want to think about what the situation is in this case, where it takes place, when it occurs, and who is part of the situation and who knows about it, right? And how might we begin to address it. So, by doing so, we are able to empower our individuals on how to identify for the what, the where, the when, the who, and the how, right, of the situation. So, has anybody coached their clients or consumers around evaluating a situation at work and how to address it? So let's think of our individuals because we mostly work with individuals with disabilities, right? So teaching individuals with disability the skill of evaluating a specific work situation is essential because it's first what it does is protective step to self-advocacy. We want to be able to empower our client to advocate for themselves. Not every time are the job coaches going to be on site. Are we going to be on site? Or are the supervisors available or even their colleagues, right? So when faced with a blocker, we want to be able to have our clients or our consumers must be able to quickly assess, is this a knowledge gap or a process error or a functional limitation? They have to be able to, we have to empower them with this skill to be able to identify the differences between a knowledge gap, a process error, or it's a functional limitation. So this evaluation prevents the client from defaulting to most common, which is running to us, right? So the solution for asking whether they have to ask for a formal accommodation. And sometimes they may not need a formal accommodation. It's more about communicating effectively with their supervisor or job coach to walk them through the process, right? So I want us to look at this scenario of evaluating a situation. We have a client or consumer, Chris, right? So Chris is an administrative assistant with ADHD. So Chris is filing a new expense report and hits a prompt asking for a specific obscure code related to capital expenditures. He knows he knows he was trained on it 2 weeks ago, but he cannot recall the code and can't find it in the 50-page digital manual. He has already spent 20 minutes aimlessly scrolling. So now Chris' internal conflict is, should I keep looking until I find it or ask my busy manager? If I ask, I look forgetful. So as we are Chris's employment specialists, right? Should Chris ask for help in this case? Do we think Chris should ask for help? And if yes, how would we coach Chris on how to evaluate the situation to receive the support he needs? So this, anyone can unmute and share. You don't have to, because putting in the chat can take some time, right, from you. And it's okay to just unmute. So if anybody has any thoughts on how we can support Chris. So first of all, does Chris need to ask his manager for help, or should he continue to go through all that 50-page digital manual, right? So in this case, what do we think that Chris maybe when Chris was training would have been beneficial if he was coached or had a highlighter where he could have marked areas that with the code, specific codes, right? So in this situation, if Chris it may benefit him to reach out to a colleague who may be doing the same task, who has already always more experience and can give him, help him find that page that with all the codes in, and Chris could put what's called the like an identifier, like a little tag to make sure that he could use it for the next time he needs it, right? So I think it would definitely be beneficial for Chris to ask for help in this scenario. So now let's look at the case of Elena. So Elena, a lab technician with lupus, chronic fatigue syndrome. So Elena's essential job involves standing at a microscope for 4 hours, consecutive hours in the morning. She is now 2.5 hours in. Her body is signaling intense fatigue, making her hands shaky and reducing her accuracy. She needs to finish the final 90 minutes of the sample analysis, but knows she will make serious errors if she continues. So Elena's internal conflict is, I can't stop. I need to prove I can do this job. I should just try to push through it and then rest later. So as Elena's job coaches, what would we do? How can we support Elena evaluate the situation she's in? If you feel free to put in the chat. If you're not comfortable unmuting, that's fine too.
If she feels like she's going to make mistakes at work, that might be a good measure of when to stop and ask for help.
Okay, very good. So how would you help Lily, how would you help Elena identify when she feels like, if she feels like she's going to make mistake, that's a time that she should pause and ask for help, right?
Yeah, that could be one. Or if she's super fatigued and not feeling good, that might be a point as well where she can evaluate and say, I don't know how useful it is for me to keep working in this scenario.
Excellent. Thank you so much, Lily. And I see I have Alana said she should request a reasonable accommodation for assisting her in continuing work in this manner so she doesn't experience so much fatigue, and this will help with fewer errors. Absolutely. Thank you so much, Alana, did you want to unmute and elaborate? Have you ever had a client you've assisted around an issue like this before?
Yeah, so typically if there's a disability such as what she's experiencing, then they are allowed to request a reasonable accommodation, whether they can be able to sit down and look at the microscope or have some other way so they don't experience so much fatigue or be able to take more frequent breaks, however it is to still assist the worker and still get the job done as well.
Excellent. Thank you so much, Alana, for elaborating. Okay. So the second skill is identifying methods to get assistance. So let's think about the individuals we serve. What does identifying methods to get assistance mean for them? Do they know how to, where to start? Someone had brought up a very good point at the beginning that clients wait for after, something happens before they ask for help. Whoever brought up that point, if it's okay, would you be okay unmuting to share more? And then we can make the connection to identify methods to get assistance. I don't know if it was in the chat, I think. So who wants to, yeah, Teresa, were you saying something?
No.
Okay. So let's identify methods to get assistance. So identifying methods to get assistance is critical step to knowing whom to ask, right? And which channel to use after evaluating the situation. So for our individuals with disability, this means distinguishing between the three channels. If they're going to ask either a peer or a supervisor or disability disability services or HR, or a job coach or a tutor. So a tutor if it's a student, right? So for supervisors, used for quick technical clarification or simple knowledge gaps, right? So we go to either a peer. Can you help me? I'm not sure about, like, for the previous example where Maria, or was it Chris couldn't find a code. That we could ask our peer. We do it at work, I'm sure. Do you remember this? I don't really remember, right? So there's sometimes we are able to use our peers, and there's sometimes where Alana brought it up, reasonable accommodation, requesting for reasonable accommodation, depending on what it is. And there's some aspect where the job coach may have to go back to retrain the client on what to do, right? Specific job task on the job. So why is it important for us to teach our consumers on how to get information on their own when they can? Why is it important to empower our clients to get their information on their own when they can? So we are not always there to play rescue, right? Because then if we're not there, what happens? If they can't get that information that they need, what may happen is that they may not be able to move on to do the next steps of their job, right? And employer may then see that they may not be competent for the job, and they may or may not keep them, right? So what do we think are some benefits for our individuals to have an idea about what they already know and what they already don't know, to assess the difference between what they know and what they don't know? Thank you so much, Alana, for self-sufficiency, just in case services are not around anymore if something happens to the company. Love that. That is so true. True. We want to always empower our individuals to be self-sufficient, right? And when we are supporting our clients around identifying methods to get assistance, we want them to be able to identified, I have this knowledge. These are things that I know, and this is the areas maybe I'm missing. So then they are able to fill in the areas that is missing or get trained for those areas, right? So now identify methods to get assistance. What are some ways our consumers can get information they need to be able to move ahead with the situation that they have evaluated? So situation, they evaluated it. How do they get the information? Do they get it from us? Do they get it from peers? Do they get it from, how? So there are many ways that our clients can get information we need that they need, right, to be able to move ahead with the situation that they have evaluated. So this can be if for example, if they know that they need help filing or completing a specific task, and they may have steps 1 and 2, but are missing 3 and 4 to do their job, right? How do we have them fill in those gaps without always maybe having to go around and asking the same question over and over again? Yeah. So I see Alana said the human resources department, peers, coworkers, or maybe employment department. Excellent. It is a challenge for some deaf community. 50% of them read up to 4th grade level. How they read the information, able to understand the information online. It takes a deaf role model to guide one another. Excellent. Thank you so much, Teresa, for such insightful knowledge. I didn't know that. So I learned something from you. Thank you so much. Can we think about any possible sources of information that our consumers likely to find in the web? Yep, some of you have already identified that. So now let's take this scenario of Chloe, right? Chloe is a lab assistant on autism spectrum disorder. Chloe's lab supervisor often gives fast, casual, verbal directives. Just get that big folder sorted out and make sure the new samples are good to go, okay? So Chloe processes information best when it is written and sequenced. She is frozen, unsure what the big folder means or the precise checklist for good to go. So the goal is to get the exact sequence information needed to start the task accurately. So our discussion questions, the first one is the priority of a formal accommodation or is this a formal accommodation request or a quick clarification on Chloe's part with her supervisor? And if so, which method is best for the immediate task? Is it interrupting the supervisor or asking a peer for unwritten rules checklist? And finally, what long-term accommodation request should Chloe make to prevent this issue in the future? Any thoughts? Priority accommodation. Alana, why do you think priority accommodation? Is this a formal accommodation? So you're saying more of a formal accommodation, or so it's not a quick clarification on her part with her supervisor. It says the supervisor often gives directive, fast and casual, so formal accommodation. Okay. So maybe, is it formal accommodation requesting that the supervisor has clear written directives for Chloe to follow to make it easier for her to follow? I think that would be beneficial. Is this something that Chloe and her job coach have to establish by either meeting with the job, if it's not a formal accommodation and you're just trying to clarify or say it's an accommodation, but not something that is put in writing. It's just, can we meet with you and Chloe to either empower Chloe to go meet with her supervisor and create her own checklist for herself, just so she can have it on her desk. So when he says the big folder, she could big folder equal to expenditure folder or report folder, something like that. But all the points that you put in the chat are, excellent. Right. Of course, absolutely. An accommodation to have things written. Right. Absolutely. I agree with that. anything else, how we can support Chloe. So requesting a formal accommodation to have things in writing from her boss as a long term. Okay. So now we have identifying methods to get assistance scenario 2, and we have someone with a learning disability. He has proofreading. She has proofreading gaps, right? So Maria is a financial aid assistant with dyslexia. Maria must send out 50 customized emails daily explaining complex loan terms. She consistently makes minor but potentially misleading spelling or grammatical errors in her numerical terms, which has led to one formal complaint. She knows she needs better proofreading, ensures all emails. So her goal is to ensure emails are free of errors and professionally accurate. So we want to know, how is this a need for skill training or formal accommodation? So if it's formal accommodation, can Maria benefit from any, like over here we have like example of Grammarly or peer checker, someone to check her work. What would be a good resource for Maria to? Is this something that she needs skill building? Should she go for extra training, tutoring? What, how could we help Maria? And feel free to unmute. It's okay. If it's easier, just unmute and share. That's totally fine with me. So for Maria, could benefit. Okay, see something in the chat. Using AI such as ChatGPT. Okay, very good. So using the AI tool to be able to is it to help with the proofreading? Excellent. So to help with proofreading, thank you so much, Alana. What else? What else would be a good tool for Maria? Someone, Alana suggested chat GTPT. Is it chat GT? Chat GBT. Okay. For proofreading and also maybe Grammarly, right? So an AI tool that can help. And maybe is it because always I'm sure peers are not always available. Text read aloud software. That's excellent, Richard. Richard, thank you so much for that. Do you know any of your clients that have used it before, Richard? And how is it helpful? No, okay. All right. That's excellent because then the person can hear it, right? And now I don't know, I see on emails where it would say, summarize the email for me. So there are a lot of AI tools that help with, yes. So Erica, is it yes that you've had clients use it before? And if you want to share, you're more than welcome to unmute. Richard said they have not used it yet, but it is helpful too to have, even the phones has. Oh, that's excellent. Yes. Thank you so much. So we're learning all of these resources and tools out there that are individuals who may be experiencing similar situations like Maria can use, right? Now we're going to a very critical um, skill section, which is selecting a person to ask. How do you coach your individuals and how to select a person to ask for help? So it's not always easy, right? How do we know who to go to? Let's just think of ourselves. When we're at work and we are stumped on something, who do we go to ask? Who do we identify as that person to ask? What are some of the qualities that person should have? What are some of the qualities of that person? How do we coach our consumers on how to select a person to ask, right? But before we can dive into that question, let's think of ourselves. What may be some of the things that we are looking for in that person? I know for me that they're approachable, right? The person would have to be approachable. That I can trust that when I approach them to ask, they would listen, right? That they would be willing to support me, like with the request I have. Anyone? So okay. Okay. So Ian said usually there is a chain of command when asking questions in the workplace, but a patient, understanding person who is invested in cooperation. Okay. Excellent. So knowledge on the subject, seniority within the company. Very good. So that's in our aspects. Now let's think of our clients on the job site. Let's say, for example, ShopRite, a grocery store, they're stuck on something. They're having difficulty with their task. How would you coach them on who to select a person to ask? I mean, I know you may not know all their coworkers at work because you are not there the whole shift with them, right? But how do we help them recognize qualities of someone that is approachable, right? And then the next question is, what are some reasons it's important to have our consumers think about selecting a person to ask? So they can select someone to ask, but not heavily relying on that person because that person may get frustrated, right? And also, what we will consider using their natural supports. So they're using their peers, that would be their natural support, their supervisors, that would also be included as their natural support person. So it's important for us to support our individuals on how to choose a person to ask who is most likely be able to assist them, because it can pay off to take some time to figure out that person, right? Because being able to trust someone to ask helps make work easier. That's why it's good to use the natural support. So if you're not available, and somebody made a great point at the beginning, so they're self-sufficient, just in case something happens to the company, they're not like, oh, I'm stuck, I don't know what to do, right? They have that self-sufficiency in order to move forward with the task, or of course using their natural support over there. But if they're only asking one person and that one person is no longer at the job, what are they going to do next, right? So if anybody wants to share what good experiences, whether personally or about your client has had around identifying someone to ask for help, whether it's been a good experience or whether it has not been a good experience, right? Anyone. So most of the time when I worked as a job coach, most people have not had good work experiences asking for, approaching someone. Is either the person gets frustrated, may yell at them, or may not even help them. So they haven't asked. Or sometimes it's just in our own families too, how they've approached when we've asked for them for help, right? So what feelings do consumers have about selecting a person to ask? Selecting a person to ask can be a little people can be nervous, right? Because especially if they don't know the individual. And think of our clients that they may feel that they view that the world is always judgmental because they have a disability, that stigma that they are aware of, that people view individuals with disability. So that may prevent them from actually approaching people to ask for help. So there are two major parts in selecting a person to ask. So when we're coaching our individuals, we want to think of these two areas. The first is identifying the person who is most likely going to be able to help and introduce what we are going to ask that person, right? So there are one is, so who are some of the people at work that we may ask? So for me, I will go to my immediate supervisor, no, my colleagues first, right? Because I have my colleagues are very helpful for me. So if I'm stuck, I go to my colleagues. Then if my colleagues are not available, then I would go to my supervisor, right? And some of you identify that there's a chain of command in asking. Um, some people, some of our individuals don't know. So they may always go to their supervisor because the supervisor was the one who interviewed them. The supervisor may have trained them. The supervisor may have been the one to show them where everything goes. So they never make the time to go over to other coworkers to ask. So I think this is important. Introduce what we are going to ask. So some people may approach the person, but they don't know what to ask, right? So how do we help them? How do we coach our individuals on how to ask what, so it's not just, I need help with, right? So we are going to go over that in a minute. So approaching the selected person. So we want to empower our individuals on how the individuals know when it's a good time to ask a person for help. So as we're all, service providers, practitioners, how do your individuals ask you for help? How do they approach you with an issue that they need help with? How do your individuals approach you with help? And how do you go about helping them? Anybody? And feel free to unmute. And don't be shy. It's okay. I know it's early, but let's, once we unmute, we're interacting. I think it will definitely be helpful. So if an individual comes to you that something is happening at work, whether they're being accused of doing something that they didn't do, and they need help with it. I let my clients know every phone call they can call me, that I know every phone call they can call me. I then give my schedule and make an in-person appointment if needed. Okay, so it sounds like you make yourself available to your clients and to support them in the best way possible. That's excellent, Richard. It's good when our clients know that we are there for them, right? So it makes it easier for them to be able to reach out to us about an issue that they're experiencing. So there are times that we need to ask for help. However, the person that we need to help the help for may be very busy, right? So we want to be able to not make ourselves available enough for our individuals to contact us if they need our help. So what questions or requests for help need to be answered right away? And what are requests for help that can wait for appointments? So I would say when we're coaching our clients on how to ask for help, they should be able to identify what are some things that are immediate, that I can't wait, that needs attention right away, right? That I would need to reach out, find either a supervisor or my colleague right away to ask. And the situations that can wait and can be asked after work or at a less busy time, right? And then finally, what are some ways we can equip our consumers with information that they need? So some of you either helping them create a checklist, I would say, or helping them have a little notebook where they can actually write important information in so they can use like have a little reference book that they can go back to. So they're not you're not asking the same thing over and over again, right? So for example, requests that involve safety that may interfere with continuing operation need to be asked right away. So those are situations where we want to be able to emergency situations. They cannot wait. If something is burning, it can say, okay, let it burn. I'll ask later for help. That's something that requires immediate attention. Questions that involve a customer waiting or other areas about immediate customer satisfaction. Those are things that we want to coach our clients to recognize those as immediate things to address right away. And things such as maybe having to request a day off, those are things that can wait, maybe when it's less busy or towards the end of the day, right? Or switch the schedule. Okay. So I have F. West said, when I was a paraeducator for the young, when they requested help, math, grammar, my first question to them, show me what you understand, and then I listen and I show you how. I like that. Do you want to elaborate on that, F. West, if you don't mind, unmuted, to share more on how you?
Can you hear me?
Yes, I can.
Yes, over the years, I noticed when the young people would request help, they really didn't know what or how and those things. And so as I clued into that, I began to learn that I needed to let them show me um, how they maybe came up with this math answer, and then I could be able to show them where or steer them to this is how it should be done. And it was just that collaboration was very helpful for me as I tried to listen to them and that this is their education, and I took that seriously. And me to be able to listen to help them move along, I guess.
And so it sounds like you listen to, you first assess the knowledge that they have and
Yes,
then the gap that needed to be filled. But you gave them the opportunity to share with you their knowledge. So it didn't come to you as if, okay, I don't know anything. I need,
right.
so it
They,
sounds like you handle it,
yes,
empowering them basically. Like, okay, you have some information, you have some knowledge and skills. I'm just here to fill in, the gaps, but you
yes.
with them in the process. And I think that's excellent.
Thank you.
Thank you so much, F. West, for sharing. Anybody else? All right. So I wanted to go into approaching the selected person. When we find the person, what is an opener when asking for help? What is an opener? So if anybody, so an opener is to introduce what we're asking for help. So for example, ways to open the conversation. So for some of us who say, excuse me, could you please help me? Right? So everybody and they're different. I'm having difficulty with. Thank you so much, Alana. So it sounds like we all know what an opener is, right? Now, depending on the opener, right, you may get a different response from other people. Has anybody had anyone approach them and the opener was just like you knew the answer, but you just didn't want to help because of how the person started it? If my participant did not understand the information, I use the whiteboard to draw information or do the chart writing. One is to be able to connect the information better. Some are visual learners. Yes, I'm a visual learner, so I could certainly relate to that. So, what would you say all your clients approach you with a good opener? Or did you have to teach some of them how to you have a better opener when they need help. Has anybody worked with someone who said, you need to help me now? Because they're struggling and it's not, oh, it's like, could you please help me? It's more of like, you need to help me now, like now. Or, right? So the opener is important because if we have some of our clients, we've talked about this, they are excellent at maybe doing the technical skills, but most of our individuals with disabilities lack that soft skills, right? That soft skill aspect, which impacts maybe them keeping a job or either getting the job or keeping the job long term. So they may mean well, it's just that they've never had to do it. So for an individual with a disability that their family members have always stepped in for them and service providers always seem to do everything for them. And now we said, oh, it's time for you to work, go into work, and you put them into work. We're excited, they got the job. But when they're stuck on a task, they don't know how to go about it. Not because somebody is like, either mom has always jumped in to do the asking or the opener, or their service provider has always been the one to step in. All right, so let's take a moment to think of a situation that you needed help for yourself or a client that you are working with, and create an opener and how you will approach the person and how you ask them. So we're not going to any breakout rooms. We're doing this just like we're taking a minute or two to come up with an opener for a situation. It could be, you could either do it from a client perspective or you could do it for yourself. And just feel free to unmute. It'll be nice to hear more voices. I've heard from F. West. I think I've heard from Alana. I've heard from Tatiana. So I've only heard from 3 out of the 18 people here with us today. I know everybody's like putting in the chat, but it would be nice if you can. My audio is not functioning. Okay, Ian, I understand. Thanks for letting me know. Yes, absolutely. I'd like to see more in the chat then. Thank you. Do you have a minute to help me with something? That's an excellent opener, Erica. Anyone else? What are some more openers? Do you have a minute to help me with something? I'm always like, can you please help me with this? Anyone? More openness. I need your expertise on. Very nice. I like to use the person's name in my opener. Yes, that's a good one. People like to be recognized by their names. They don't like to be, hey, can you help me? Right? It's like, John, could you please help me? Or hello. For me, I'll always start with like, hi, how are you? How was your day so far? Just a little conversation. Then I said, I'm kind of stuck on this. Could you please, right? So I like all the openness I see are excellent. Any other that anybody wants to share? But these are all great. Thank you so much for contributing in the chat. Okay, so now we have this scenario on selecting and approaching the right person to ask. Do I have any volunteer on who wants to read this?
I can read it.
Okay, thank you so much, Victoria.
Okay, the quick technical block, peer reverse manager. Alex, a marketing coordinator with generalized anxiety disorder. Alex is blocked on a high priority task because she can't access a shared folder on the computer server. He knows his manager Sarah is swamped, but also knows Sarah can fix it instantly. His peer Jen might know the trick, but is often slow to reply. The task is due in 30 minutes. And then
Excellent.
Okay.
Yes, please. Yes, Victoria. Yes, you could read the discussion questions too.
Okay. Who is the correct resource to ask first? Sarah, manager, or Jen, peer? Efficiency versus social cost. If he chooses Jen, peer, write the sentences 1 to 2 script Alex should use to ensure Jen replies immediately. Scripting the ask, urgency and specificity. If he chooses Sarah, manager, how should he frame the ask to avoid sounding incompetent or anxious?
Excellent. Thank you so much. Oh, that's okay, Alana. I understand. So thank you, Victoria. That was very kind of you to volunteer to read. So how could we assist Sarah? I mean, Alex. So he has generalized anxiety disorder. He has work due in 30 minutes. Who is the correct resource to ask? Because Sarah would reply, but I mean, is it Sarah is swamped, but he also knows Sarah can fix it instantly. So should he approach Sarah right away? Go to her office, ask her, please, this is due. I'm sure she wouldn't mind taking some time, right? Or Jen, the peer. If he's going to ask Jen, I would say then he would have to also go to her office, if unless he works remotely. Anybody else? Any thoughts? Okay. For the sake of time, I want to leave some time enough to be able to get to by sharing some of the PowerPoint in the chat with everybody. So let's look at this scenario and we go to the last one, which is presenting your request. So this is similar. So we can skip this and go to presenting your request using the use formula. So use means use your opener. The U in the use formula means use your opener. This S means say the request, and the E means end with a thank you, right? So when we are coaching our individuals, we want to, of course, we talk about the opener, using a polite opener, then coaching them to use state what their request is. I need help. Could you please, hi John, could you please help me with um finding the code to um this medical billing code for arthritis or something like that, and end with thank you so much for your help, right? So that's the presenting your request. So having a formula in this case is called USE. So for being able to come up with acronyms to help your individuals remember steps to a skill is important. So this is our final case today, which is on Ben. So Ben, a new administrative assistant with dyslexia, non-disclosed. Ben is required to log all client interactions into a complex online training log database. The process involves copying long strings of sequential case notes, numbers, and dates from one screen to 12 different fields in the log. When Ben is making consistent critical data transposition errors, mixing up numbers and dates, because the process requires intense, sustained visual scanning, he's now 45 minutes into a task that should take 15 minutes. So the goal is to stop making errors and complete the task efficiently. So the first question is this a failure of Ben's knowledge, or does he know the procedure? Or is this a functional limitation for Ben? What do we think? So the first question focuses on evaluating the situation. So is the situation that Ben is going through a knowledge failure on his part, or a functional limitation, which is the visual scanning and transcription process is a barrier for him? What does everybody think? Okay, something in the chat. Functional limitation. Thank you, Lance. Yep, I agree. Functional limitation. And So if it's functional limitation, maybe Ben could benefit from a formal accommodation, correct? And if I'm not sure if I see if he's using multiple screens, but I think that may be beneficial too, right? Okay, moving on to question 2. Does Ben need to request a formal accommodation which requires disclosure or a simple process change? What do we think? Should he request an accommodation and should it involve disclosure or just a simple process change? What is everyone's thought? Does can anyone relate to this case? Feel free to unmute. It'll be nice to hear from you before we leave. For those of you who can. So we talked about it. I think we just said he could benefit from formal accommodation, but we have to have the conversation with Ben about disclosure, right? And if he does, it can some company depends. They can request accommodation and disclose, but HR does not share with the manager about the disability. They will just share that this person reached out to us about formal accommodation, and this is what the accommodation request is, and it's been approved. So if you have that HR aspect that the supervisor may not even have to know. So it depends on what the office policy and procedures are around accommodation. And selecting a person to ask who is the best person for a quick non-disclosure based solution. Is it the supervisor, Jane, or the peer, Alex, who has been there longer? So here I would say it's the supervisor because she could help, right? She'll be able to help maybe give him either, if he doesn't have already, 2 screens, 2 monitors. Maybe she can make that happen because this seems more for the supervisor than his peer. And finally, presenting your request. So if Ben was to write a request, how would we put it together for him to make this request happen? So maybe well, hello, Jane. I've noticed transportation. Okay, oh, this is Jane. I've noticed transportation errors are high when copying these long strings. Is there a way to print or paste the data directly? So this is him asking, right? So I see Teresa. Thank you so much for this train. I need to leave now. Absolutely. No problem, Teresa. Thank you so much for joining. We're wrapping up now. And then, so a summary. Thank you so much. So asking for help is it's a very critical skill for our individuals, even for ourselves. But when we're supporting our individuals, it's important to empower them to be able to ask for help, whether it being on a job, in social setting, or at school, because we're not always going to be there to help them through, to be there to say, identify that they need help and put the things in place. By empowering them with the skills and strategies on how to ask for help, this will help them become self-sufficient in so many other areas of their lives, not just employment. And asking for help, we can all agree that it can be a little uncomfortable to ask because of the uncertainty of what we're going to get from other people, right? Some people may be open to just helping, and some people may make you feel really bad for asking. But at the end of the day, we want to empower them that even if they ask, whatever the response they get, it's not because they did anything wrong. It's not because they don't know. It's not because they have a disability. That's why they got the response they did. If it's positive, great. If it's negative, they find somebody else to ask. There's always someone out there willing to help, right? And not to be afraid of asking for help because that's the only way we get better and improve, right? So I just want to say thank you so much and have a great rest of your day. And thank you for joining today's training. And I'm going to put the training materials in the chat. I wanted to, but let me do it now. So those of you who are still on can get it. And I'll see if those who didn't get it because they had to leave, it can be mailed to you. I mean, emailed. Okay. So I put the PDF in the file for those of you who are still on, and thank you so much and have a great day. And please, thank you. Have a great day, Holly. Have a great day, everyone. Thank you so much. And I wanted to be able to put the chat, I guess for those of you who are still on, I'll try to put the link up to the survey, if you could please complete it. And thank you so much for attending today's training. I really appreciate your help and your patience. I wasn't able to. And if anybody have any questions, I'm more than happy to answer. And I put the link to the survey in the chat. You're so welcome. Thank you so much, everyone, for your patience and for all your active participation. And I look forward to seeing you all next month.